Good morning, Dr. Karan here from Dr. PK Life. Today's video is about the varicose vein. So, ladies, have you ever noticed the bulging, twisted veins on your legs, or that are heavy, itchy feeling at the end of the day? You're not alone. I used to have medical spa many years ago in Southern California, and used to do the vein treatment. Um, but I get to see lots of people with varicosities, venous insufficiency, and varicose vein as a common condition affecting millions of women, particularly. So let's talk about the cause, prevention, and modern treatment options. So, what causes varicose veins and venous insufficiency? Your leg veins carry blood back to the heart. I'm sure most of you know that. But when those one way valves weaken or fall or fail, so blood starts pooling back in your vein, leading to varicose vein. So the valves gets damaged. Usually, normally the vein has a valve, different valves at different level, and they're supposed to prevent the blood pooling at the lower end of your leg. So but the valves are damaged for whatever reason, then blood starts pooling and starts causing more damage to the vein. So that leads to the varicose vein, pulling up the blood in your vein after the valves are damaged. So what are the top causes? Pregnancy causes increased blood volume and hormonal changes that weaken the vein wall. Number two, genetics. If your mom had them, chances are you might too. Sedentary lifestyle. Sitting or standing too long reduces circulation, and that can lead that over the time. Hormonal changes. Estrogen plays a role in weakening vein valves. Obesity, extra weight increases pressure on leg veins. Tight clothing, high heels. These restrict calf muscle movement and vein flow. So, what happens when you have chronic venous insufficiency? What are the symptoms you feel? You feel aching, heavy, throbbing legs, swelling, especially after long periods of standing, skin discoloration, itching, eczematous skin changes, nighttime leg cramps, restless legs, visible blue, purple, bulging veins. How can you prevent it? Simple habits can protect your vein. Move often. Avoid sitting or standing for long hours. Flex your calves. Simple thing you can do is do tiptoeing. You can move up on your tip like that. That contracts your calf muscles and squeezes the vein and move the blood upward toward your heart. Elevate your legs, especially at the end of the day. Put your leg up in the chair or ottoman, and that will help you. Wear compression stockings. They improve circulation and reduce swelling. Stay hydrated. Thick blood strains the venous system. Lose excessive weight. Even 10 pounds can make a huge difference. Walking, swimming, biking, those kind of exercises are quite helpful. And ditch your high heels. See, when you are wearing high heels, that disengages your calf muscles when you're walking, because pressure is more on the front muscles of the leg. So if you are not using high heels, that's going to help you. So ditch high heels. Lower heels engage calf pumps better. And calf has such a huge amount of venous plexus. We call it peripheral heart of the body. So calf muscles plays a huge role in your circulation. So when to see a venous specialist? If you feel that your veins are painful, itchy, causing leg ulcer, or tired and cramping and interfering with your sleep, it's time to see a venous specialist. Even for cosmetic purpose, you can see venous specialist. But if you don't have those symptoms, but you want to just get corrected, insurance is not usually don't cover it if it is not affecting your quality of life. Modern treatment, there are lots of treatment available beyond venous stripping. Today's treatment are minimally invasive. And most of them are covered by insurance because most of the patients I see, they usually have symptoms of cramping, leg pain, which is interfering with the lifestyle at work, interfering with the sleep. So there are lots of options out there. Number one is sclerotherapy. The doctor would inject tiny amount of solution that collapses the small veins, like a great for a spider veins. Radiofrequency ablation, RFA, or endovenous laser treatment, EVLT. They use heat to seal shut larger vein. Venous seal is a medical grade glue, is also used to close the vein. Microphlebectomy, tiny incisions, they are made over bulging veins painlessly, and ultimately they scar and they closes. Compression therapy, so it's very supportive and non-surgical and usually a good thing to do initial state. So ladies, don't ignore your legs. Varicose veins are more than cosmetic. They are sign of deeper circulatory issues and health issues. So sooner we act, the easier and more efficient the treatment is going to be. So follow me for more vein and circulation tips. And talk to your doctor if you have vein issue. Thank you for watching.